So I said you're here for the left foot, correct?
Yes.
So let's talk about what happened here. Now, to the viewers who are not familiar with this kind of post-surgery stuff, this is compartment syndrome, all right? Post-compartment syndrome. So what the surgeons had to do is they had to cut open and decompress the whole entire area. Otherwise, there's a high risk of him potentially losing that leg and the foot. So tell us, how did that compartment syndrome happen in the first place?
I was on vacation with the family, and me and my son, teenage son, were jumping the pool to jump further, and I happened to kick myself in the calf, and then next thing I felt a pop, and the foot, it just starts to swell like a volleyball, and my wife the night we flew back to New York, and we went to the emergency room, and the doctor was like, wow, you took a flight, you should not have took a flight. And then we went to the surgery. The different surgeon checked, and then went to emergency surgery. The doctor told me if you are any late, they could cut your amputate the leg.
Yeah, that's actually I thought you had the surgery in Florida. Wow, okay, so that's a whole different ballgame. That's gutsy. You're very lucky to have it too. Yes, I see the decompressor over here too. Mm-hmm. Okay, so ever since that's been going on, you mentioned that you've been having some trouble walking with that left foot.
Yeah, well, first of all, it took a year for this to recover. I was at home, mm-hmm. and the muscle is all, atrophy. Mm-hmm. And so I started my chiropractor back then, told me to walk. You got to start walking. So I was very, diligent, walked 4 or 5 times a week, and then to the point where I developed Achilles tendonitis. Mm-hmm. I guess my muscle wasn't catching up with the activity. Mm-hmm. So then that chiropractor started treating me for tendonitis using laser, and then I felt that wasn't working, so I went to the rehab, physical therapy, and after a while this gone away, maybe about 3-4 months, but then I had a dull pain when I walk walk excessively, not excessively, but maybe half an hour, then I see the vein popping like now, there's a vein here, and dull pain inside here and inside here. Then the physical therapist said, when you have that, put your leg up and put ice on it. So I've been, it's been getting better and worse. Sometimes I do have to travel to work, so I would, have to walk, somewhat, and that would, I would walk with a cane. Yeah.
Got it. Okay. So let's start comparing some things over here. Mm-hmm. I also want to see to the viewers over here as well. Okay, so this is the tibialis anterior muscle. See this? How much this sinks in? You viewers can see that? Now take a look on the right side. See this? This is nice and firm. So this muscle has complete atrophy. There's nothing there. Now there's no point trying to test here because that's where the surgeons cut into. So we're going to check the gastric and the soleus. The gastric is also, it's kind of weak on the medial head. See, this is nice and firm. See, on the medial side is weak. We check the outside of it. Here, see? The lateral head of the gastric is completely atrophied. Now we check a little deeper for the soleus. This is also weak too. Now traditionally the sacral nerves and also lower lumbar nerves, 4 and 5 and sacral nerves all innervate the tibial nerve and the sciatic nerve, all go down there, okay? Mm-hmm. And the peroneal nerves, so we'll take a look, see what's going on, all that stuff over here. And let's take a look at what's going on with that foot. Now, during the gait, what I saw in the analysis was the fact that he was actually walking toe out, all right? So usually when there is a toeing out, there might either be a knee misalignment, hip misalignment, or it could be an upper cervical problem, all in the head. So we're going to confirm those fellows over here, but also in addition to his arches were completely collapsed on both sides. we do require sacral nerve function to keep and maintain this as well, in addition to the tibialis posterior muscle that attaches to the bottom over here to bring it in this way to have an arch. But I strongly suspect that's also compromised on him as well, because there's a much more deeper muscle inside there as well. So we're going to investigate that sacral nerve on him. And now other things we're going to test on is, I'm going to check. See, okay, so the talus is misaligned over here. Calcaneus is slightly misaligned. Fibula is definitely out. Now here's another thing I want you to do. Okay. Now, like a gas pedal on the car, I want you to press down real hard. Hard as you can, quick, relax. That's a fourth lumbar nerve. Press down hard. Okay, this is weak. So the fifth lumbar nerve goes over here, and now we're gonna test the sacral nerves. Okay, go ahead. Okay, that's decent. Press down. See, now it's getting weak. Press down. There you go, very weak. So now this is what confirmed us. This is part of the muscle testing. So his fourth lumbar nerves, they're going down to here just fine. Fifth lumbar nerve is compromised over here, okay? And now we got the lower sacral nerves, okay? Most likely the 2 or the 3 is compromised because it's not working too well, whereas the 4 and the 5, when I tested over here, no, there's sufficient enough muscle strength over here. The moment I go to the pinky, no, it's gone. So we got some kind of, the mid-sacral nerve involvement. So let's take a look, see what's going on in the x-rays. Now, because your feet are splayed outward, toe out, or duck feet, traditionally, it's the problems over here. Now, your atlas is almost parallel to the floor. Normal should be here, okay, slightly tilted, but your occiput is tilted even more this way, all right? In addition to your head also is not level either. It's gapped open like this way on the right-hand side. So I'm going to confirm on you what's going on in this region over here. And in addition to the viewers can see, there is that pacemaker with the leads and all that stuff. So that's not a immediate concern over here. That's a separate matter. Now, what I do see here in the lower lumbar area, okay, I do see these wedges over here. Okay, these sacral segments, especially this one over here, it's gapped wide open over here. So that second sacral segment, same thing over here, everything should be lining up, but no. Everything is lining up where it's like it tilts this way and then tilts this way. Mm-hmm. So it's tilted, gapped open right there. So it may be pinching off that nerve going on the left leg over there. So we need to confirm that on you during examination. And as we alluded to before, okay, we tested your muscle strength. The fourth lumbar, even though it's degenerated over here, seems to be okay, but number 5, the fifth lumbar nerve, is compromised. It's weaker on you, okay, your second toe. So we're going to double check what's going on here, here. And in addition to, the haunted pelvis, the long game, okay, not today's visit, but in the future visit, I want to re-level this pelvis because everyone can see over here, the pelvis is sucking down this way. By adjusting his right hip, it'll re-level it this way, but we can't right now because with the triage. Most urgent thing right now is to get you walking again, and that's what this area over here is for.
Doctor, if I may, I was told that I'm 1 inch shorter on one side of the leg. I don't know if that's true.
Yeah.
It is?
Yeah. So it's short. Yeah, right. So it's short on this side. So okay. That's what I'm saying. We're gonna re-level it. Okay. So visualization. We're looking for that swelling. For any potential candidates. Got some stuff over here. We do see something up here as well. A lot of swelling there. So let's confirm what we have. Now, because there's some degeneration in that area, the fifth and the fourth lumbar areas to the sacrum, the nerve may be chronic and may have shriveled up because it's been there for quite some time. So that's why we're tilting the scope. So we got that area, and then there's a 2S right there. Okay. All right. Down a little bit. Yeah, there it is, right there. How's that fella right there? Pain?
No pain. Yeah.
Yeah.
Yes.
Yeah, that's a draw. Yeah, too less. Yeah, see, his right hip is not moving either. Okay. Oh, that fellow right there.
A little bit pain.
Yeah, that's a fifth lumbar. Okay. Okay, this is partially fixated, but not a lot. So we're gonna leave that alone. Not too bad. See, he's stuck right there.
Yeah.
Yep.
Very tight.
Exactly. Right there. See? So that's stuck. Breathe.
Ooh.
Okay, go ahead.
Ooh.
Walk around, sir.
Ooh. Feel more strength.
More strength.
More strength, right?
More strength in what area, sir?
Just, I feel, not as weak before.
Have a seat over here. Which muscle you feel different right now?
I just feel here more strength.
Good. Let's check this one. Okay, relax the foot. How is this, sir?
This one, it's
You see, it's still atrophied, but
Yeah.
see, now there's some kind of, see, there's little muscles. We got some muscle strength over here. Hey, see, the gastroc started to come back a little bit. Soleus, actually, soleus is more strength than your gastroc. The gastroc is still compromised, still atrophied. Because it's not going to be instantaneous because this has been there for quite some time, so we already lost a lot of muscle function. So we have some muscle strength over here as well, the medial head of the gastroc. Okay, so that's doing better. Good. All right. Hey, that's good promise. Let's check everything else. Good. Press down. Feel that difference?
Yeah.
Press down. Tell me, what's different about this one?
Here more strength.
Yeah.
I feel, before it was just like futile, it was just,
That's what I feel as well. Okay,
Yeah.
press down. Hey, how do you like that, huh? Press more. See? Start to get. Press down. See? Now you start to get more. What's different about this fourth toe when you press down?
toe.
When you press on here, feel that difference right there?
Yeah.
Compared to before, it was much looser,
Right.
right? So when you press down, what's different about it?
I feel like it's more controlled. The leg is more controllable. Before it was just like, it feel like it's whopping.
All right. Great. Okay. There it is. Okay. Coming up, sir.
Whoa.
Go ahead. Walk up and down the hallway.
Oh, here, this is even better. This strength.
So you said it's more strength. How much better would you say right now?
Well, compared to the first time, it was probably 10% better.
And now?
I mean, it's 10% better than the first time. The first time was maybe 30-40%.
30-40%. So
Yeah.
so then now we're looking at 40-50% compared to when you first walked in.
Yeah.
Hey, that's great improvements right there.
Yeah.
Okay, now let's check your occiput. Hey, how do you like that? You cleared up your occiput. See, full range of motion. We don't have to touch it. Now let's work on your foot. Same as before. Gas pedal, press down. Good. Press down. Tell me what's different about that.
More even.
I agree.
Feel more even.
Exactly, I agree. I concur. Because before, this was weaker. Now we have actual symmetrical strength over here.
Yeah.
Okay, go ahead. Press down again. Good. Press down. Good. Press down. What's different about your feet now?
Just I feel more control, have more control on the left foot.
Exactly. So
Yeah.
that's what we did for you on that one. Okay, now we get to work. See, now this talus is still out. Okay, so we're gonna set this fella. There you go. There's that fella.
Yeah.
I'm gonna set this poor fella. There you go. No, no, no. There it is. Good. Okay, go ahead. Walk around, sir.
Yeah, so yeah, I feel more firm on the leg. Yeah.
There's another thing I want to show to the viewers. If you can see from the very beginning of his gait, this arch was completely collapsed. Now we have a little arch in there, very slight. Okay, so that's good progress right there.
After when I went back home, I feel a lot more strength and control of the left ankle. Then I was walking, and then I got a little carried away, and I started walking around the neighborhood. I walked 3 blocks, 2 blocks down, 1 block up, and I went back home. And after half an hour, I started feeling, the ankles, burning and then tired. So I put the foot up and put some ice on it, and then now I'm slowly walking. But I do feel better, that's for sure,
Okay.
of the left ankle.
All right, so it sounds like you kind of overdid it, but also to recap to the viewers as well.
Uh-huh.
So you said you were able to do, I understand you were overexcited, you walked 3 blocks. Prior to that, how many blocks were you able to walk?
Well, I was walking 3 blocks without a cane.
Mm-hmm.
Before I was using the cane and walk maybe 1 block.
Mm.
Yeah, so it did a lot for me.
All right, that's great. That's great progress right there. Okay, well, thank you for the update.
Okay, thank you.